Hello everyone, welcome to Banajawad PU College online classes. Today we are going to be starting the continuation of yesterday session. Yesterday we are discussing the problems related to the reproductive health and also the India's efforts towards the attaining of reproductive healthy society. What kind of plans and what kind of programs India was started, when it was started, and what is the goals of RCH program we are discussing yesterday. That is also in some books they mentioned under the category of strategies, but I am explaining separately strategies, goals and the programs which was initiated by the India. Then already we discussed about the programs, when it was started, and about the family planning programs, about the RCH, and after that goals of RCH also we have discussed. Now we'll move forward to the continuation of yesterday's, that is strategies or we can say steps to be taken to solve the reproductive health problems. What kind of steps we need to take, or else the RCH, the government was taken to control the or to overcome the problems related to the reproductive health. Those are, we'll discuss one by one. First one, the government had to be created awareness among the fertile couples. Must be created awareness among the fertile couples as well as marriageable age group peoples. Among the two members, that is creating awareness about the problems what they are facing and how they need to be overcome those problems. These awareness should be created among the fertile couples as well as peoples of marriageable age groups. Clear? Now in this, how they are going to be creating awareness? That is very important thing. Here creating awareness among the fertile couples and people of marriageable age, okay fine. How they are going to be creating awareness? How to create public awareness? See that? How to create public awareness. How to create public awareness? By which means they are going to be creating awareness among the fertile couples and peoples of marriageable age groups. By means what they use to create this awareness? First of all, they will take with the help of audio visuals. With the help of audio visuals as well as with the help of print and media. These are the most powerful weapons for the government and non-governmental agencies. For the government and non-governmental agencies have to be taken. Have to be taken various steps to create awareness. To create awareness among the peoples about what? About reproduction related aspects. Clear? Now once again we will repeat it. With the help of audio visuals and as well as with the help of print and media undertaken by government and as well as non-governmental agencies have to be taken various strategies or various steps to create awareness among the peoples about reproduction related aspects. And also parents and other close relatives, teachers, along with that friends also have a major role. In the dissemination. Dissemination means spreading of the above information. Whatever the information the RCH have to be spreading among the peoples, have to be aware the peoples, such information passed by the two ways. One is with the help of government and non-governmental agencies by using audio visuals and print and media. One more way with the help of parents, other close relatives, teachers and also friends plays a major role to create the awareness among the fertile couples and marriageable age group peoples should know about some major aspects related to the reproduction are. Means in which areas they are going to be knowing the things. In which areas they need the knowledge. They need the information. That is, we'll discuss one by one. First area, they should know about family planning options. What kind of family planning options are there available in the society? How we are going to be using those things? How we are getting rid from the problems which are related to the reproductive health by using the family planning programs or family planning options. Clear? This is the one thing we need to aware the peoples. This is the one thing we have to explain about these things, what kind of options they have, how they are going to be using these family planning options, and how they will get benefit while the following of these family planning options. For example, we are noticing that small families, they will get the incentives from the government. The government is giving some of the incentives to the small families also. That is also under the category of family planning options. It is also, we need to tell about this family planning to the peoples who are in the marriageable age group as well as fertile couples. Okay, the next one, birth control methods. What kind of birth control methods are available and what are the advantages of those methods and what are the disadvantages of those methods? We have to explain to the peoples, then only the peoples will get an idea about those birth control measures. They will take which one they will follow, which one they will feel comfortable and which one they wanted to follow, and by which case and which method is comfortable for them, they will choose by their own. Okay, these things also. The second one more time will repeat it. Birth control methods. What kind of birth control methods are available? How it is useful and what are the advantages are there and what are the disadvantages of the birth control methods? We need to explain clearly to the peoples who are in fertile couples, who are in the age of reproduction. Clear? The next one, if you go to the third one, it is also very important, prenatal care. Prenatal care means before delivery. Before delivery, pregnancy time, what kind of measures mother have to take and how it is being healthy condition. What kind of precautions the mother have to follow, such things we need to clearly explain to the pregnant women or pregnant mother. This is, we can call it as a prenatal care. It is also important criteria, important strategy. Okay, the next one, postnatal care. Similarly like as a prenatal care, but it is postnatal care means nothing but after delivery. It is before delivery, that is after delivery. Before delivery means nothing but what we can say it as, before delivery, we need to take care about the pregnant mother. But after delivery also, we need to take about mother as well as child. Okay, caring about two persons after delivery. That is, we can call it as a postnatal care of the mother and child. Here we need to explain what kind of precautions we need to take after the delivery, how we can get the normal conditions or normal health. Okay, the next one, fifth one, we can see here the importance of breastfeeding. It is also very important. Means some peoples are not having an idea about the breastfeeding. What is the importance of breastfeeding? How it is advantageous to the children? We have to explain to them. It is why it is important. For example, if you take here breastfeeding, if the mother milk is very important to the child. That is very important. For example, if you know that second, while discussing third chapter, human reproduction, there they may explain about the colostrum. Colostrum is a first milk. It having so many antibodies which will give immune power to the children. That's what breastfeeding also very important. This idea also very important to the fertile couples and marriageable age group peoples. Okay, fine. Now the next one, sixth one, that is importance of giving equal opportunities for the males and females. Okay, for the males and females we have to give equal importance. Nowadays this is the major problem. The discrimination is there between the males and females. We are facing a lot of problems regarding that. Nowadays we are observing in the society the discrimination is present, the discrimination is there between the male child and female child. That is not good for the society, so that we have to explain them importance of giving equal opportunities for the males and female child. Okay, then as well as we have to create awareness about the problems arise due to population explosion. It means, already yesterday I told you that overpopulation is one of the major problem we are noticing in our society. That's what we have to give information clearly what kind of problems we are getting due to the overpopulation. That things we have to explain to the peoples clearly. Then only the peoples can understand what kind of consequences they will face because of the overpopulation, how they are going to be rectifying that. Okay, these things they come to know that clearly. Okay, then move forward to the seventh one, that is by creating awareness about the child immunization programs. We know that very well. We are observing in our home, for example, if you are in your home, in small kids are there, your mother or maybe your relatives, they will take them into the hospital for the purpose of getting vaccines like TB vaccines or maybe BCG vaccines. They will take. The reason is that is the immunity going to be increases. For example, nowadays if you observe it, polio vaccines. Polio vaccine also one of the immunization program. Such programs information also we must be know. Then only we are getting full-fledged idea about the reproductive health and how we are going to be overcome such problems which we are getting in the daily life. Okay, clear? The next one, we'll move forward to the eighth one, by educating the peoples, by educating the couples to reduce the maternal as well as infant mortality rate. It is also very important task because by educating the peoples, for example, if you take one problem, yesterday we are explaining child marriages or else early marriages. That is the major problem to increase the maternal and infant mortality rate. So that we have to aware the peoples the consequences they will face because of child marriages and all. Okay, that is also one of the important thing. That is the eighth one. Now the next we'll move forward to these all things are related to the first one, that is creating awareness among the fertile couples and peoples of marriageable age group. Clear? Is clear at all? Yes. Now we'll move to the second one. That is prevention of social evils. Evils means dangerous situations or else harmful situations like sexual abuse and sex related crimes. Sex related crimes. For example, rape cases, forcible sexual participation. These all things are belonging to this sexual abuse and sex related crimes. It is also one of the major problem. Yesterday we are discussing. These things are causing physical damages to the health of the woman. Okay, that's what, how we are going to be overcome that problem, how we are going to be overcome these problems. First of all, we need to create awareness of problems due to the uncontrolled population growth. Why? What is the relation between the uncontrolled population growth and social evils? Is there any relation? Anybody knows? Okay, fine. I will explain that. Awareness of problems due to the uncontrolled population growth means the population is going to be increases in uncontrollable manner. It is also cause the or leads to the social events like sexual abuse and sex-related crimes, etc. Need to be created so that people should think and take out necessary steps to prevent them and thereby building up a reproductive healthy society. See that? One more time I will repeat it. Prevention of social events like sexual abuse and sex-related crimes. How we are going to be preventing them? It's majorly we need to create problems caused due to the uncontrollable population growth. Because of this only, mainly we'll face the problem regarding sexual abuse and sex-related crimes. So that we need to be created information so that people come to know that what kind of measures they have to take, necessarily step to prevent them and thereby building up a reproductively healthy society. Clear? These are the two strategies we are discussing till now. Now the third one will move forward to the rising the marriageable age group. Rising the marriageable age group. It is the third strategy. Rising the marriageable age group. We know that already child marriages. Because of child marriages, we are facing a lot of problems that we know clearly. Okay, now how we are overcome such problems? What kind of measures we need to take? That is mainly rising the marriageable age. According to Child Marriage Act, Prohibition of Child Marriage Act, for the females is the age 18 years must. Then for males age is 21 years is must be. While getting the marriage, the female age must be in 18 years, the male age must be 21 years. Okay, this is given by, it states by Prohibition of Child Marriage Act. Clear? Now the next one, fourth one, that is the what is goal to introduce the sex education in schools. It is a debatable point. Why? What is the need to introduce the sex education in schools? So many people are arguing about this. Why they are arguing? Because people who are in school age, for example, adolescent age, the like 10th standard peoples or 9th standard peoples or PU standard peoples, they don't have an idea about the sex related problems, why they are getting, how they are going to be treating those. They don't have any idea about those. But the peoples are telling they may spoil when you are introducing the sex education in the schools. That is not the correct. Because if they don't have an idea about anything, how they are going to be overcome such problems? That is natural things occurring in the body of any person. That's what they must be know about the sex education, what kind of problems they are getting, how they are going to be treating those problems. This is the must and should thing they come to know that. Clear? That's what they are introducing, the goal of introduce the sex education in the schools. Okay, see that. That is to provide scientific information. To provide scientific information to the young children. Young children means nothing but for PU students or 10th standard students or 9th standard students or young children. For them we need to give scientific information, not hypothetical information. Particularly the proper scientific information you need to provide to them. Then they come to know that which is the real thing, which is not real thing. Clear? Now, so as to discourage, why we need to provide the main scientific information to the children's way? To discourage children from believing in myths and clear the misconceptions. It means they have so many doubts regarding the problems, for example, regarding menstrual cycle, what kind of changes are happening during that time, and regarding adolescent age changes. They have so many doubts in that. That's what we need to give proper scientific reasons to rectifying, to get clear about such misconceptions. That's what we need this one. Okay, about sex related aspects, and also provide proper information about safe and hygienic sexual practices. It means they don't have an idea about the sex related aspects, mean how they are going to be participating in sexual contact, and what kind of problems they will face at that time. They don't have an idea about, means they can get so many problems. That's what we need to tell about the safe and hygienic sexual practices. One thing. Next one, STDs. About the STDs. What is the meaning of STDs? What kind of, how many types are there? What kind of symptoms we'll get because of STDs? How we are going to be treating those symptoms? We'll discuss later on clearly. But we need to provide the information about STDs here also. Clear? Now the next one, problems related to adolescence about reproductive organs. It means problems related to adolescence. Problems related to adolescence mean, for example, somebody will get afraid while changes are happening, hormonal changes are happening in their body during in adolescent period. They will get afraid. Why it is happening? Anything happened to my body? Okay, like that they will feel and they will get afraid about that. So that we need to tell about the adolescent changes, like nothing but secondary sexual characters. What kind of changes are happening in the males, what kind of changes are happening in the female's body. We need to tell about those clearly to the peoples. Then they will get clear idea about the adolescent age changes. Now lastly, we'll tell about the reproductive organs. What can means reproductive organs functioning, how it is working, how we are going to be caring about those. These all things we need to explain to the peoples. This is the complete information about the strategies of reproductive health. Yesterday we are discussing problems which are related to the reproductive health. Today we are clearing all the strategies which we need to take to avoid the problems related to the reproduction. In the last session, we discussed about the different kinds of action plans which are given by the RCH, how we are using those, and how we are overcome from some of the problems which are related to the reproductive health. But now, so many people are telling, you can do that, you can do this, and you can do that things. Why you are not doing such things? Who will provide requirements which are needed for the doing of such action plans or properly executing such action plans? That is also very important thing here. That is what we are discussing now. What are the requirements? What are the requirements needed to implement such action plans? What are the action plans were given by RCH? How we are going to be executing them? How we are going to be implement them? We need some of the equipment, and some of the medical facilities to implement such programs. Those things we'll discuss now. First of all, for successful action plan to attain reproductive health, to get the proper reproductive health successfully, we need a strong infrastructural facilities and as well as professional expertise. It means professional means nothing but the doctors. We need to provide some knowledge about those, and as well as material support. Material support also we need, because if you go to the government hospital, why we are not getting proper treatment in the government hospital? The reason, because of lack of material support. Lack of material support by the government. This is a major problem in the government hospitals. Why we are getting a proper treatment in the private hospitals means mainly in the private hospitals they will provide strong infrastructural facilities and as well as professional expertise as well as proper material support to the hospital. This is the difference between the government and private hospitals. But nowadays in the government hospitals also we are getting proper treatment because government also take caring about these things. Okay, now we are getting proper equipment and proper expert in the hospitals and strong infrastructural facilities also in the hospitals. Even in the government hospitals we are getting. Then next, these are necessary. Why it is important? To provide medical health and care for reproduction related problems like menstrual problems or maybe infertility problems or maybe abortions or maybe related to the contraception. If the person having these problems related to the reproductive health, for them we need to take care about those peoples who are admitted in the hospital. Because of that we need these three things, that is the infrastructural facilities and professional expertise and as well as material support. Clear? Are you understanding this? One more time I will repeat it. For successful action plan to attain reproductive health require a strong infrastructural facilities and as well as professional expertise and material support. Why it is necessary? To provide medical help as well as care for reproduction related problems which are presented to the person such as menstrual problems, infertility problems or abortion problems or contraception problems. In these areas we require these the three things which we are discussing. Okay, now we'll move forward to the second point, that is the required ban on amniocentesis. Statutory ban means nothing but required. Statutory meaning is required. Ban on amniocentesis. What is the amniocentesis actually? Amniocentesis means it is a technique which is used to find out or determine the sex and as well as which is used to determine the abnormalities presented in the baby. Clear? But the actual purpose is to started this amniocentesis technique is to find out the abnormalities which are presented in the baby. Then obviously if the baby having any kind of chromosomal disorders or any kind of deformities, we can remove the baby from the mother. Then obviously that purpose we started. But actually nowadays most of the peoples are misusing this amniocentesis. That's what the government is taken strict rule or strict action on the amniocentesis such as ban on amniocentesis especially. Clear? Now later on we will discuss clearly about the amniocentesis technique, procedure and all those things. Next one we will move to the massive child immunization. Massive child immunization meaning is, for example, if you take polio drops. Polio drops is given, the child is not having the polio, but we are giving every year polio drops up to 5 years. Why we are giving? That is massive child immunization program. Why we are giving is to protecting from the in future the baby may get polio. That's what we need to provide massive dose to the children's. That is, we can call it as a massive child immunization. Immunization means nothing but we are giving vaccines to the children's. That is massive. Massive means continuously every year in the time period when they are yearly once we are going to be giving the vaccines, polio vaccines to the children's. This is the massive immunization. Now the next one, not only polio vaccines, measles vaccines or hepatitis B vaccines, BCG vaccines, many things, but mostly we know well about the polio vaccination. Okay. Now the next one will go for the research should be encouraged. Research should be encouraged means nothing but we have to, our government have to be encourage the research and as well as giving more support to the government and non-governmental agencies. Means we need to give means RCH have to give government for non-governmental agencies for they have to give support and encouragement. Both needed. If you take governmental things or maybe non-governmental agencies, they need the main encouragement from the RCH as well as encouragement from the support from the RCH. If they provided these two things to the government agencies for non-governmental agencies to find out new birth control methods, to find out for what purpose they are giving encouragement, for what purpose they are giving support, to get the profit. That is also one thing. That is, they will get the new control methods, means birth control methods, as well as whatever the old birth control methods are presented, we are giving some importance or support to improve them. Existing ones we are going to be improving. Once again I will repeat it. Research should be encouraged and supported by government and non-governmental agencies to find out a new birth control methods and to improve upon existing ones. It is lack in the India mainly because of this reason, because the research should not be encouraged in India properly and should not be supported by government and non-governmental agencies. So that's what most of our scientists are migrating into the foreign countries to do their work. That is also drawback for the India. So that's many peoples or many governmental policies for we are suggesting, or peoples are going to be suggesting to give more support and encouragement to the scientists to find out the new birth control measures as well as to improve upon existing ones. Clear? Now the next one, last one, overall increased medical facilities. Overall increased medical facilities means whatever the problems the peoples were getting, first of all, you can increase the medical facilities in the government hospitals, even in the private hospitals. It is the major thing. If you are increasing medical facilities for sex related problems, we are going to be treating easily. Clear? These are things we needed. What are the requirements need to implement such plans means these all are the requirements we need. Then only we are executing action plans properly. Okay, clear?